Dr. Paul here. This is a topic I talk to a lot of my patients is where to not get medical information. Very important that you understand this. So many people try to figure it out on their own, or they, so the number one, the worst place is the internet. And that covers a lot. We're talking Google, we're talking chat, chat rooms, people have, but see, the thing is with chat rooms, it's more often people who have complaints and more people are unhappy with whatever. And so then you go into there with unhappy people and they scare you into doing anything because of their bad experiences or whatever. So you got to realize that who are you talking to? Are you talking to someone what do they have to do with you? And there's a lot of people out there who think they know more than they do, or people who have no scientific background and try to make sense of a field of science and a field of neuroscience, which is very complex, and try to do it on their own. Now, even if someone says, well, I'm a scientist, oh, great. You work in the laboratory? Oh, great. Okay. When's the last time you prescribed medications? My sister is advising me, she's a ER doctor. Great. Okay. Does she treat depression? Did she treat anxiety? No, okay. Well, she's a doctor. Okay, that's great, but it's not what she does. But my brother's a pediatrician. Great. Does he treat? No, he treats kids. He doesn't feel comfortable with that. Okay. So, so basically, anything on the internet can be just terrible. There's warnings, there's suicide, this and that. There's all this scary stuff. So if you're already kind of afraid of taking medications, all you need to do is go online and just scare yourself into say, forget it. The other thing I see a lot of is I give a medication to a person, or I give samples, let's say, or something, and then look up the medication. That's like that's the kiss of death. When someone looks up a medication, then they see all this, oh, he didn't tell me about all this stuff and all these. Look, I'm going to tell you the things that are real, the side effects to look for. I'm not going to go through, all this nonsense of, spending hours talking about like what happened in the laboratory to the mice that took whatever, so you got to really be very, very careful about, even if it's WebMD or it seems like it's a more medical site, that might be a little bit better, but there's still, it's not individualized to you. So when you're looking at these generalized information that's scary looking and warnings and this and that, it's really not the best place for advice. Number two, family and friends. I mean, some people might laugh at this because you think, oh, how obvious. Of course you don't get medical advice from family and friends, right? Oh, people do it all the time. Are you kidding me? My brother thinks I shouldn't take this. Why? Oh, he just doesn't believe. Okay, great. So your brother has his medical degree from who? From where? Oh, no, he's not a doctor. Oh, okay. And you're taking medical advice from him. Why? So sometimes you just point out the absurdity and they think, oh, okay, I get it. I understand what you're trying to say. Sometimes they get offended. My brother's real smart, or my sister's, really smart. Okay, great. My sister's an RN. I go, oh, great. So she's smart and she's an RN, but she doesn't prescribe medication. She's not a clinician. So it doesn't matter intelligence. It matters training. It matters what you're doing for a job. And, that's probably you should listen to someone who actually does it for a living, and is good at it. But you don't want to get advice from family and friends like, oh, you don't want to start your kid on ADD medication that could potentially help them. Oh, I wouldn't, oh, you wouldn't put your kid on either? Yeah, so then all these mothers are talking about, oh, I wouldn't do that to my child. And so then now they're talking to friends and families to get advice. So there's a lot of that going on. And then there's the third thing is pharmacists. Not to down pharmacists because they understand medication, they went to school for it, but they're not clinicians and they don't prescribe. So they understand to a point, but they don't understand the next level because it's not what they do. And the problem is, and if you've gone to the pharmacy and you get a medication, there's always that paper that's attached to it. We call it a package insert. So if you take that paper part and you unfold it, and you're going to be like, holy moly, what is all this stuff? And And then it's all this same scary stuff you're going to see on the internet. So the best thing to do is take that thing and throw it away, because you don't want to be looking at that, because if it's going to be something that's going to talk you out of taking something that's going to help you, that's going to be damaging. And then you're going to take advice from a piece of paper that a pharmacist gives you. Now, the other thing about pharmacists is some of them think they're clinicians, unfortunately, and they give people advice. I think some of them are not satisfied with their job of taking orders from doctors. They want to give people their advice. That's why they have these side consultations. And I've seen this before. Well, does your doctor know that you're taking this and this together? And I'm thinking, yeah, I put them. So I've had that with pharmacists, where the pharmacist actually told a person recently, oh, you shouldn't take this together, just take that away. So the pharmacist actually told the person to take something away. The person called me a week or two later, suicidal thinking. And I was like, suicidal thinking? What? I thought she was totally stable last time I talked to her. I go, well, you're still taking this? No, I'm not taking this anymore. I go, well, why aren't you taking that anymore? Oh, the pharmacist told me to stop. And I go, like, what? And so I said, start it again, call me in a few days. She called me back. I'm doing way better. I called the pharmacist. I was trying my best not to chew him out, but I said, let me talk to the pharmacist who talked to the person. And I told the pharmacist, what are you doing giving this person advice? And you told them to stop the medication. Do you understand the person was suicidal? That could come back to, and he was appalled. I'm so sorry. I won't do it again. But again, they do that stuff. They give people bad advice. They'll say, oh, does your doctor tell you that's an antipsychotic medication? And it's like, then the person is like, does the doctor think I'm psychotic? Oh my God, So all this problems that are started. So I can have the person in the office, everything's doing great, all the directions are given, and then they go out, and then you go on the internet, you talk to family and friends, you talk to the pharmacist, and everything falls apart. And it happens more than I would hope it would happen. So the best advice is, listen to the doctor. It's not like we get everything right all the time, because we have to, with this field of medicine, there's trial and error. We have to test things out. We got to try it. We got to get a feel for it. We got to figure out how your body works. All that stuff we got to keep in mind with you all the time. And these other people don't have that. They don't have that for you. The doctor that you trust is the one to listen to. And when in realizing that doctors have to figure it out. Sometimes if I give you something that gives you a side effect, okay, well, let's try something else that won't give you a side effect. So it's just a matter of that. And hopefully that kind of helps to clarify, because this is a very big issue that I talk to a lot of patients about. So hopefully this helps you.